I'm Curtis Dale Schmidt. I'm a captain in the U.S. Army Dental Corps, and currently I'm an oral maxillofacial surgery resident. People think that the Army is kind of the big brother controlling what you do and what you say, and it's not the case at all. You live in your own house. You don't always have to live in the barracks. The Army doesn't want to dictate what you do in your free time aside from keeping you safe and, of course, representing the Army well. It's not quite what people picture, and I would say that's probably what most of my family pictured when I told them I was going to join the military. I didn't know if I'd like the Army. I was scared. I didn't know what to expect, but I knew that the Army helped pay for school. My undergraduate training was at Franklin College in Franklin, Indiana. Dental school was at Indiana University. The Army really made it possible for me to focus on school rather than having to work and try to pay the bills at the same time. You can have your dental school, supplies, equipment, everything completely paid for while also getting a stipend.
I'm Robert Glenn Hale, Lieutenant Colonel, Program Director, Oral and Maxillofacial Surgery.
I see Dr. Hale as a colleague and as a friend, but also as a mentor. It's really an exceptional situation for the Army, I think, that we have Dr. Hale here as a senior trainer.
The Army teaches more residents than any other institution in the country.
The most exciting thing about residency is that everything is so new.
And I got to tell you, the residents perform very well. The residents scored in the 95th percentile on the average, and a couple of them scored in the 99th and 100th percentile. And that's against programs like Harvard, Johns Hopkins, and UCLA.
My training here at Rook Army Medical Center is better than I could have gotten anywhere else.
I think people think the Army is just a bunch of running around the field, using antiquated equipment, being stuck in places that they don't want to live. I think that's a bad misconception.
We have state-of-the-art equipment, sometimes even more so than civilians, I think, because it's not coming out of our pocket.
Most practitioners in civilian life are limited to what they can purchase. New equipment is the norm in the Army, and high-tech equipment, technology that is just emerging.
One of the things is a cone beam CT scanner, and it's called the iCAD. It's really cutting edge for dental implants. It allows us to take CT scans and see in 3 dimensions the bone that's available for placement, anatomic structures like nerves and blood vessels, and we can do that with minimal radiation exposure.
That's like a $250,000 piece of equipment. The general looked at it and said, we'll buy it for this medical center and for all others.
Our decisions on treatment are not driven by their ability to pay. And what we do is based solely on what we think is best for that patient and not driven by reimbursements and things of that nature.
In the purest sense, the Army allows us to do what we do best, and that is be a medical professional. In the 18 years that I was in the reserves, I was only called up once to put boots on and go overseas.
In residency, you don't get deployed at all. You're in a non-deployable status.
The reserve doctors who go absolutely love it, and they go 3 months every 3-4 years. And they just stand up and say, I want to go again, I want to go again, because they can help so many, not only soldiers, but the local population.
To bond with your coworkers and fellow residents in a social setting outside of the hospital is not only enjoyable for me, but it makes you work better together when you're in the hospital.
My quality of life now is I'm happy. I enjoy getting up in the morning and going to work. And that wasn't always the way it was when I was in private practice.
Because of the housing allowance that I receive and the income that we still make, it allows me to still have a house and a car and motorcycle and a kayak, a lot of things that I probably wouldn't be able to afford if I were in a civilian residency.
And you'll get your tuition paid for, you get a stipend, all you through dental school, and the patients will be there right away. So you'll be developing your skills right out of dental school.
I look forward to coming to work every day. When I'm away from it, it fills my thoughts, and I get excited to come back, which is a dream come true.
If you want to be a dentist and you want to practice in the best patients in the world, you should consider the U.S. Army. They'll love what you do for them, they'll appreciate what you do for them, and you won't have to work with any nonsense around you. You can just take care of the patients.